Jenny with Nursing Digipedia. Today in this video we will learn how to read and comprehend a doctor's prescription. Doctors frequently use abbreviation and short forms to write a prescription. Therefore, in today's video we will learn how to decode those abbreviations and also understand how the prescribed medicines to be taken, such as after or before food, at night or day, how many times per day, and so on. So, without further ado, let's get into the presentation.
Here is a sample prescription form for our learning purpose. Whenever you visit a doctor, a few details are taken such as age, gender, blood pressure, weight, etc. And then the doctor listens to you and writes down all your health issues to diagnose, and then the doctor prescribes medicine. You will see the symbol RX in prescription. The symbol RX is basically said to stand for the Latin word recipe, meaning to take, something resembling a doctor's prescription in being an advisable or corrective course of action. So, before we begin learning the details shown in the table, let us be familiar with a few short forms that doctors frequently use in their prescriptions, such as TAB for tablets, CAP for capsules, SYP for syrup, mg for milligram, which is the power or the strength of a medicine or a drug. In the table below, we will also see several other abbreviations used by doctors, as well as the meaning of the abbreviations. Knowing the meaning of the abbreviation will allow you to determine how to use a prescribed medicine, such as when to take the medicine, how to take the medicine, what dose needs to be taken, and so on. Also note that I am using XYZ as a medicine name just for our easy understanding and learning purpose, rather than mentioning any specific medicine name. So let's start with number 1. Number 1, we have CAP XYZ 100 mg AC. So CAP is capsule, 100 mg is the power of the medicine, and abbreviation used AC. The Latin term of AC is antecibum, which means before meals. So this medicine need to be taken before meals. Number 2, we have CAP XYZ 200 mg PC. So TAB is tablet, 200 mg is the power of the medicine, and abbreviation used PC. The Latin term is postcibum, which means after meals. So this medicine need to be taken after meals. Number 3, we have CAP XYZ 300 mg OD. So CAP is capsule, 300 mg is the power of the medicine, and abbreviation used OD. The Latin term of OD is omni die, which means once a day. So you should take one medicine in every 24 hours interval. So you can see how it works now. This is getting easier, right? Okay, let us keep going, and now as you understand how CAP and TAB is used for capsules and tablets respectively, along with the power of the medicine mentioned as mg, we will quickly go through with many other abbreviations. Okay, so number 4, we have TAB XYZ 400 mg BID. The Latin term of BID is bis in die, which means twice a day. So you should take this medicine in every 12 hours interval. Number 5, CAP XYZ 500 mg TID. The Latin term of TID is ter in die, which means 3 times a day. Basically, one medicine in every 8 hours interval. Number 6, TAB XYZ 600 mg QID. The Latin term of QID is quarter in die, which means 4 times a day. Basically, one medicine in every 6 hours interval. Number 7, CAP XYZ 10 mg Q2H. The Latin term of Q2H is queque tu hora, which means every 2 hours interval. So you should take this medicine after every 2 hours. Number 8. Tap XYZ 20 mg HS. The Latin term of HS is hora somni, which means at bedtime. Number 9. Tap XYZ 30 mg QAD. The Latin term of QAD is quaque alternis die, which means every other day or alternate days. Number 10. Tap XYZ 40 mg SOS. The Latin term of SOS is si opus sit, which means if required. Sometimes doctor prescribe a medicine and tell you to use only if you really need it or else don't use it. Number 11. Cap XYZ 50 mg QAM. The Latin term of QAM is quaque ante meridiem, which means every morning. Number 12. Tap XYZ 100 mg PO. The Latin term of PO is per os, which means orally or by mouth. Number 13. Tap XYZ 10 mg QH. The Latin term of QH is quaque hora, which means every hour. Number 14. Tap XYZ 300 mg QD. The Latin term of QD is quaque die, which means every day. Number 15. Cap XYZ 400 mg PRN. The Latin term of PRN is pro renata, which means as needed. Number 16. Tab XYZ SL, which means sublingually. The medicine need to take by keeping under the tongue. Number 17. INJ XYZ stat. So here INJ stands for injection and the Latin term of stat is statim, which means immediately. A stat medication is one that is to be given immediately in response to an emergency or other urgency. Number 18. Injection XYZ IV. IV stands for intravenous, which means medication administered into your vein using a needle or injection. Number 19. Injection XYZ 1 ml IM. IM stands for intramuscular. So here 1 ml medication administered into your muscles using a needle or injection. Number 20. Injection XYZ U100SC. Here U stand for unit. Some injections medication is measured in unit. For an example, injection insulin are given in unit. Standard insulin contains 100 units in 1 ml. So SC stands for subcutaneous. Subcutaneous means under the skin. In this type of injection, a short needle is used to inject a drug into the tissue layer between the skin and the muscle. Number 21. SYP XYZ 1 TSF BD. Here SYP is syrup, TSF is teaspoonful and BD is twice a day. So you shall take 1 teaspoonful twice a day. Number 22. Syrup XYZ 1 TBSF. TBSF stands for tablespoonful. Number 23. Eye drop 2 GTT OD. Whenever you see GTT, it means drop. The Latin term of OD is oculus dexter. It means right eye. Number 24. Eye drop 1 GTT OS. The Latin term of OS is oculus sinister. It means left eye. Number 25. XYZ eye drop 2 GTT OU. The Latin term of OU is oculus uterae and it means both eyes. Number 26. XYZ eardrop 2 GTT AD. The Latin term of AD is aureus dextra and it means right ear. Number 27, XYZ eardrop Trugititti AS. The Latin term of AS is aureus sinistra and it means left ear. Number 28, XYZ eardrop Trugititti AU. The Latin term of AU is aureus unitas and it means both ears. Please keep in mind that many times the direction could be unclear or confusing. So always ask your healthcare provider or pharmacist to explain. Do not take your medication unless you understand the instructions properly.
I hope this video was useful. Let us know in your comments how helpful the video was. You can also suggest topics that you would want us to cover. Do not forget to like, share and subscribe. And I will see you soon with another video. Till then, take care and stay healthy.